Hello, everyone, and good afternoon. Thanks for joining us on this Monday morning. We are very excited to start the week talking with Sean Goldy from Johns Hopkins Center for Psychedelic and Consciousness Research to talk a little bit, unsurprisingly, about psychedelics, sort of that emerging medicine that is coming out, and kind of the work. Of course, as a good reminder, if any of you out there have a question or a comment you'd like to throw in the chat, you are very welcome to do that. You can just put that on any platform, and we'll get to that as we go. But with all that out of the way, Sean, thanks so much for joining. I know we were chatting a little bit in the pre-show. How are you doing?
Doing well, doing well. Yeah, great to be here. Excited to talk a little bit about psychedelics and all things under the sun uh, related to that.
In general, a big desire to learn more about psychedelics. I feel like it is something that is really having a renaissance, really re-emerging, but there's still some things that people don't understand about it or still new. So maybe a great spot to start. I know it's sort of trite in a lot of ways, but would love to hear about your background, how you came to psychedelics, all of that history.
Yeah, yeah, sure. Let's see how I can kind of condense this
Sure.
down. So I started studying uh, psychology as an underpath of a variety of different ways. Like when I was young, trying to figure out what on earth I wanted to do. I started school as like a business major, figured out pretty quickly that wasn't for me. I wanted to do something involved in science, and got involved in some labs there, talking about ways that people can instill long-lasting change in their lives for the better. And we would talk about things like meditation, near-death experiences. Psychedelics started popping up, and this was back in like the 20 teens, something around there. And so that's first put psychedelics on my radar. But I was trying to figure out how on earth I could study these in leaving long lasting duration that just struck me as such an incredible, impactful thing to look into. So I did my PhD in psychology at the University of California, Irvine, where I studied non-pharmacological ways of instilling these types of changes. So I looked at the types of emotions and experiences that people can feel, like the emotion awe, how things that are awe-inspiring can kind of shift how you think about yourself, make you more pro-social, instill sort of positive health and mental health benefits. But from there, I was still a bit unsatisfied because that kind of work, we did cool things like getting people to go out to Sequoia National Forest and feel awe, or having them watch certain videos. But when you measure that in the lab, you get effects, and maybe they're significant, as we were talking about in a statistical sense, that didn't seem that powerful and they didn't seem to last that long. So psychedelics were always on my radar still because it seemed pretty adjacent and relevant, but I was always trying to look for a way that you can more like instill these kind of long-lasting changes. So long story short, I had an opening and was able to segue the research that I was doing in non-pharmacological interventions into pharmacological ones, specifically in psychedelics. And it was really just a dream job to come here at Johns Hopkins at the Center for Psychedelic and Consciousness Research, where I can apply all those sorts of things that have been interesting a long time into these really impactful types of research projects.
Yeah, I think that's fantastic. And I do definitely want to learn more about, what you're doing at Johns Hopkins and all of that stuff as well. But in terms of taking on the psychedelics component, was there any feedback from friends or family? Was anyone sort of surprised? Was it sort of, I don't know, what's the word exactly? Was it sort of shocking to anyone, or was it sort of something that you were able to easily explain, sort of those things you're trying to have that positive impact in people's lives, and psychedelics is one of those routes for people to do that?
Yeah, I'd say for the folks who knew me well, it probably wasn't that surprising.
Sure. That's fair.
Because I would be talking about these sorts of things. I guess when you think about like my PhD work, it was experimental psychology, but it was on these things that were a bit out there, frankly, like
Yeah.
awe-inspiring events. And very recently, until very recently, there wasn't much of a science behind it. But what was so exciting during that time that we were kind of laying out the groundwork for that. When you talk about things like changing your sense of self and well-being, self-transcendence, social connection. These are all now things that we can study scientifically, but for a long period of time, it was a little bit out there and different. And so I'd say that for my friends and family, other coworkers, PhD cohorts, they kind of knew, because I was always talking about like this sort of stuff is really interesting and fascinating. Psychedelics seem to bring up those types of things. Well, I'm sure we'll talk about it later, like what happens during the trip, right? And there's a lot of work that would suggest that those sorts of experiences are important for the downstream therapeutic benefits that people see. And so I'd say that like kind of lent itself well to me, not only saying like, hey, I want to study this, I'm interested in it, but here's also the reasons why it's important to look into.
Yeah, that's fantastic. I do also think it's probably helped, not that it should be validated by the fact that there is so much more research pouring into psychedelics and there is that data to back it up, but I do think that is an important part, and I'm glad that you're a part of kind of growing that set of data, which is important. All right, well then I'd love to talk a little bit about, it's such a mouthful, the Johns Hopkins Center for Psychedelic and Consciousness Research, kind of what it is and kind of the work that's being done there.
Yeah, absolutely. So the center, for a couple decades now, has been focused on investigating psychedelics and their effects pretty broadly. It was famously started. This work was famously started about over 20 years ago now by late Roland Griffiths, who's investigating psilocybin, or the ingredient that's typically found in magic mushrooms, so to speak, right? And looking at how psilocybin has a variety of different impacts. So this has often been the case in clinical trials. So when we look at a specific population who has a certain clinical diagnosis along the lines of, say, depression, clinical indications. And we've approached this from many, many, many different angles. I think what's so interesting about the center, or I guess we can abbreviate this, yeah, definitely, is that we have a pretty multidisciplinary approach. Most of the faculty members there come from different backgrounds in psychology. We also have neuroscientists, epidemiologists. So what's great about that is that you get all these different perspectives on how to conduct research and different research angles, to look at different methods, what have you, shop, so to speak. And that was how we kind of hit the ground running and got funding for trials looking at specifically psilocybin, and how that can impact these different clinical indications. Then we've also branched out into different areas too, looking at comparing psilocybin to, say, other types of substances that people might typically use. Right now, we're looking at expanding to newer psychedelics as well. So multiple different angles are one of their primary focuses, because that just tends to be how you can get funding, right? And it's an important thing to study when we're talking about, hey, anxiety, other mental health factors, other physiological health factors. We're looking at chronic lower back pain now. That kind of runs the gambit of getting a lot of support. But we've also looked into, well-being among what you would call people without a clinical diagnosis, so healthy volunteers.
Yeah.
So really, the CPCR, I'd say, is like global leader in trials, and we're a psychedelic is
Interesting to think about, because I feel like, at least for us, the lens has always been, using psychedelics as medicine to treat people who, have certain conditions that have been kind of failed ultimately by the pharmacological side of things, and treat depression, really, really deep depression or deep anxiety. Seems to only really be scratched a lot of the times by things like psychedelics. But that's interesting to think that, healthy people also can see those benefits, but I guess ultimately in the name, which is interesting. Okay, very cool. Can you talk us through kind of what you do specifically among all that, what sort of the thing that you focus on?
We focus broadly on examining the subjective effects of psychedelics. So the trip, what goes on during it? Are there better ways that we can capture it? These effects, are they important for the therapeutic, and how are they important for it? So this is one of the biggest, I'd say, like, controversies within the field. You'll have a couple of different schools of thought of people going, well, these subjective effects, the acute subjective effects, the trip, they are important. They come to mind. They, in some studies, are related to these downstream therapeutic outcomes. They're correlated with it. The more that people have a, say, mystical experience is associated in some studies with decreases in depression. But you also find that some studies don't always find that. And there are some folks who are like, well, psychedelics seem to have these, they can serve as improving brain plasticity at multiple different levels. We can just zoom out, say, plasticity writ large. And that's really what's going on here. It's interesting, but it's kind of fluff. It's really these things are going on at like neuronal levels that are driving a change. So I'm really interested in trying to see how we can better encapsulate that and speak to those two different types of arguments that are going on. So broadly, I've been helping with a variety of different trials, from looking at psilocybin for obsessive compulsive. Right now, my main focus is that I'm spearheading and designing a trial that's going to compare to what we would call rapid acting psychedelics, so DMT and then 5-MeO-DMT, and seeing how we can compare their subjective effects, but also their effects on well-being and other outcomes.
That is so cool. Can you talk us through what it takes to like design a study? What are you focused on? How do you even put that together? Love to hear about that.
Yeah, it's a pretty long process. It's
Yeah.
quite different from what I did during my PhD work. So, it involves designing a study. If let's say we're sticking with a clinical trial, we want people to come in, we want to give them a drug. So then you're going to think about what sort of design do you want to have? Do you want it to be the gold standard in clinical trial work, which is a randomized placebo-controlled trial where people are randomized to receive one type of drug versus another and compared to placebo? Do you want healthy participants? Do you want to look at a specific clinical diagnosis? There's all sorts of things to consider. And then there's the huge process of writing a protocol that delineates the design, background information, safety considerations, all of that in dozens of pages, several thousands of words long document that you have to get that through ethics approval. So we have our institutional review board, IRB. We also, because we're dealing with Schedule 1 drugs, right, we need to get approval from FDA, DEA, and also our supplier of the drug. So there's multiple different things, multiple different moving pieces here where it can take several months from starting the protocol and actually getting it through ethics approval, getting the drug supplied to us when we can finally recruit people.
That is wild. Do you think we ever see, we've also been focusing on cannabis, which has been through its own rescheduling process and journey right now. But do you think we ever see the scheduling change for those drugs because it can prove those medical benefits? I feel like that's one of the key reasons that Schedule 1 drugs are Schedule 1 is they show no medical benefits. Do you see that changing in the future at all? Or it doesn't matter and you guys are ultimately able to navigate it, whatever schedule it is, if it's the highest schedule, Schedule 1, or something lower?
Yeah, a great question. And one that I wish I could have a crystal ball to see
That's
into, right?
totally fair.
I'd say there's a lot of promise, despite what maybe some folks here might have heard in recent news. There was a push for MDMA assisted therapy for PTSD, and there was a lot of fervor behind that, a lot of backing, and there was an advisory board meeting, just an advisory board meeting where they looked at a variety of different aspects of evidence supporting whether it's helpful for PTSD, the safety profiles. Anyway, it's too much to go into now, but the advisory board basically voted, we don't think it's safe. We're not convinced that it's safe, and
Yes.
we're not convinced that it's effective. I think that's a hot take, and there are a lot of different hot takes within that, and it still remains to be seen what the actual FDA will vote on that. But the reason for bringing that up is that that can have ramifications for broader psychedelics. MDMA is not a classic psychedelic, so to speak. It's
Sure.
got a different classification, but it's within the same level, right, and the same sort of discussions that people have. In a couple years, I think, I'm forgetting the exact timeline, but psilocybin will certainly go up for approval for treatment in front of the FDA. And I think that's going to be a far more promising. Hopefully, what will happen is that there'll be lessons learned from the latest sort of thing with MDMA. And I think there's a lot of great work, strong work, suggesting that psilocybin has that it has positive effects on depression and or anxiety, as you want to look at it. So I would say I'm hopeful. I mean, obviously, there's probably, you could argue, a bit of bias here. I'm a scientist. I'm interested in this, but as a scientist, I'm also trying to see, like, what is the objective truth here? Are these things helpful for people? Are they not helpful? And I think a lot of the evidence suggests that they are. So I'm hopeful that in the future we might see at least some sort of approval, whether it's a reclassification, I'm not sure, but an approval for, say, psychedelics being used as a treatment.
I think that was a perfect answer for a hard question. Sorry to set you up with that, but I think you answered it very well. I do agree. I think with the FDA stuff that happened recently, I think people were, at least in the psychedelic community, kind of surprised and disappointed. But like you're saying, I think their pushback was that they weren't sure that they're managing the risk appropriately, or kind of getting a sense of that. So I think with continued research, continued information, data, that is what really kind of informs that change. And I think doing the work now could kind of set the path for those changes to be made in the future, and kind of have a little bit more embracing there, which is interesting. I'm seeing some good questions come in, so I'm keeping an eye on them. Don't worry, we'll get to them. We're just going to chat a little bit longer, but keep them coming if you have them. Would love to walk through just in general, because you've done some of the actual dosing sessions themselves, right? What I would love to just hear what that's like. What, I don't know, all the details of that. I think that's so interesting. Would love to hear what that's like.
Yeah, absolutely. You know, I'll say it's honestly one of the most meaningful and incredible parts of my job. There's a lot that goes into these sessions, even before people step into the room to receive their dose, right? We're preparing them for that. So participants, they're screened to ensure that they can safely participate in the study, that they can be a part of it. We look at a variety of different inclusionary and exclusionary criteria. And then depending on the trial, there's always a number of different preparation sessions where basically the session monitors, guides, therapists, whatever moniker you want to use there, we always have two of them. At least one is a licensed therapist in some level, master's, PhD, MD, what have you. We're in the room with them, and we're there to get to know them. We're there to, depending on the study, kind of provide a level of therapy, because some trials will say, like, we want to use a different aspect of psychological therapy to see if this also can help with the effects. We wanted, but really, what's underlying all of that is that we want to develop a sense of rapport and trust with the participant, because data which suggests that can be helpful in ensuring that they have a positive experience. So on the day of, when they finally get in, after a number of preparation sessions that can be from 2 to 4, maybe more, they come in. The room is like a softly lit, kind of comfortable setting. You can probably look this up online. They're lying on a couch. They have eye shades on. We're careful not to call them blindfolds, because they are not blindfolds. And it's more like a sleeping mask. They have these big, comfortable headphones on where they're listening to a curated playlist that we have. And then the same people that have been with them throughout their preparation sessions, we're in the room with them. So, and the funny thing is, you know, it can be a lot more boring than you might expect sitting there, because people can have like these deeply immersive experiences. I've been in sessions before where the person doesn't talk almost the entire time, either and to say, like, I'm going to get a drink of water and can I use the restroom now? But I've also been in sessions where it can be far more involved. You know, we tell people that it's very difficult to predict what it's going to be like. We can say, here are the types of things that you might experience. And from the data that we know that these substances are much, 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 much safer than other sorts of things, certainly other Schedule 1 drugs, but certainly than other legal drugs that are out there. So we talk about what to expect, but they can still be challenging. People can have a variety of intense emotions and experiences that come up. And we're there to help them through it. We're not meant to direct the experience in any sort of way. We're really just there to provide support. And this can be in the frame of just discussing what's going on with them. Sometimes participants want to talk a little bit about what they're seeing, what they're feeling. They might say, "Hey, can you write this down? I want to talk about it later because I might not remember it."
Yeah.
And so it's really, I think it's honestly a privilege to be able to be in the room with them during those experiences. And I'd say what happens after tends to be the most rich sort of experience in general, because that's when they're out of the acute effects of it, and they want to talk potentially
Mhm.
about what they saw, what they experienced. And it's, again, there's no way to predict it, but there's such a wide variety of things that people can see, feel, and report that can be deeply, deeply meaningful to them. That is just incredible.
Yeah, that's fantastic. I mean, again, that's so cool to be a part of that healing journey for a ton of people. And, even though you're like you're saying, some of them can be very internal experiences, from what I've heard and seen and read. It is very, very impactful. Would love to know, for the music playlist, are
Hmm.
you curating that at all for different types? If someone's like, I love jazz and jazz is only it, or like, I love pop, is it just sort of, I don't know, is it changed or like tailored at all? Or is it just sort of a gentle, kind of like if you were getting a massage, that sort of
Hmm.
relaxing general music?
Yeah, so it changes. For years, we've been using about the same playlist that uses a variety of different like classical tunes, but also from across the world with many different genres. And you can actually find that on Spotify if you look
What?
for it. Yeah,
Okay.
yeah. I think it's called like the Johns Hopkins psilocybin playlist, something along those lines.
That's
But we're
amazing.
also using a variety of other ones too, because there are different reasons why people can maybe listen to that music. They might go, well, this classical music, this really doesn't speak to me, and it kind of brings up the other sorts of feelings. And we want to make sure that it can be as positive, or at least just a neutral experience as possible. So we're experimenting with some other types of playlists right now. One of our trials, we actually, participants can think about the type of songs and things that they might want to listen to during certain aspects of the trial. But there are different studies across the world too, where people have a even more curated playlists. We've just found that the ones we've had so far seem to work pretty well, but we're expanding and exploring different ways to bring
That is amazing. Also, we are just posting it in the chat. If anyone, it's just a link to it. I know it
that
looks ugly,
in.
but if anyone wants to listen to it, because I think that's super cool. Do a lot of people listen to it, I guess, ahead of it so they know what's coming? Again, not to focus too much on the music, but
Yeah,
um,
sometimes they do. Sometimes they do, which can be, that could be an issue because we're saying, all right, well now you're kind of familiar with it. But we
sure.
do all sometimes have multiple sessions as well, where they can hear the same playlist. And there's some different thinking there about what the music does. Is it meant to be something that kind of uh, propels you along
Mhm.
uh, on the different types of songs that come up, this different types of feelings, or is it sort of meant to just provide this kind of like background
Backdrop,
um,
sort of
backdrop,
calm.
yeah, that just like allows you to go deeper.
Yeah.
And that's, there's just still more research to look into that.
Yeah. Okay. Very fair. It is interesting to see, I know psychedelics obviously have a big impact on people, but music, it does just in general. I know, mentioning Alzheimer's, you see all those
Mm,
videos where someone will listen to music from 30 years ago or 40 years ago. They know all of the lyrics, even if they don't recognize,
mm.
their sibling or child or anything like that. So that is very interesting to see and hear. Does that change? Is anything different between the psychedelic trials where they are having that psychedelic experience and ones where they are not? Or is it any different?
You
You know what I
mean
mean?
where, depending on if they like have a certain type of music or?
Where they're able to have like psychedelics, but it's one where you don't have any big trip. Kind of like you were saying before, there's that kind of debate over, do you need a trip to have that positive impact,
Uh,
or do you not do those trials where it's a non-psychedelic experience?
yeah, so there's a variety of work that's kind of touched on that. So we have like studies where they'll look at a low dose of a psychedelic
Mhm.
compared to very high doses, and you can see what we'd call like dose effects, basically. The higher the dose, the more intense, unsurprisingly, experience you're going to have, and the
Sure.
more likely you are to have what we would call, say, mystical experiences or just these sort of like deeply immersive breakthrough type of experiences. And then in certain work, like that is related to these downstream like well-being outcomes. So how intense it was, how mystical it was, how many of these different sort of acute subjective effects you report having can be correlated with saying like, okay, I had decreases in anxiety or depression on average, at least. And you know, we're also looking at different ways of comparing like high level, high dose experiences to say more lower doses in terms of placebos are already always an issue within this field because you can't, it's very tough to be blind to an
Sure.
experience like that.
Sure.
So we'll juggle and consider active placebos where we might give people a very, very low dose of something that still has a degree of psychoactive or physiological effects. And we can say like, okay, compared to this level of effects,
Mm-hmm.
what differences do we see?
That is very interesting. Okay, perfect. That makes sense. All right, let me see. I'm going to try to turn to some of the questions here just as we're going really quickly.
Sure.
Um, so a question from Shroom Sleep, which has a mushroom in their thing, which is perfect.
Mhm.
Do you do any work with digital therapy combined with psychedelic therapy?
Oh, well, I would say not exactly within the trials that we do. So you could argue that there's an aspect of that in some of the things. So one of the trials that I work with, several of our prep and what we would call integration sessions are what happens after the dosing session. They can happen virtually over Zoom,
Hmm.
where we're zooming in. It'll be myself and another therapist there with our participant, talking with them. Okay, that we're going to prepare you for this, or afterwards, let's talk about your experience. We typically have a few of those in person, of course, because we believe that that's pretty important, especially the preparation session right before dosing session and the integration session right after tend to be in person. But then from that, just because it can be an extra burden, right, on people to have to come in. Sometimes people are flying from out well across the country to be a part
Sure.
of these trials, and we still want to be able to talk with them, discuss with them, and see how they're doing. And so there's an aspect, I guess you could argue, that could be considered digital therapy, but different from, say, what therapists would be doing out in the field right now with their own private practice.
Like talk therapy or something like that. That makes sense. So ultimately, just using technology as a way to make it more accessible and easier on patients and have a bigger pool, basically, of people to access
Hmm.
ultimately.
Hmm.
Makes sense. All right, quick question. Again, Shroom has some good questions here. Uh, have you tried,
Hmm.
I'm going to mispronounce it, Musimol? Is that
Interesting.
right?
I
Oh,
actually haven't heard of
okay.
these unless they're talking about an aspect of ibogaine, but probably not because those aren't legal. Legal. No, I haven't.
Okay.
I haven't studied those before, but we do want to. We're continuing. I mean, we might get to this in the future. But we're continuing to think about novel psychedelics or ones
Mhm.
that people haven't quite studied before. For those out there who are either experienced psychonauts or know about Alexander Shulgin's work, right?
Yeah.
There's a variety of different compounds to investigate. And so we do want to branch into that, but we haven't gone into those compounds yet. I'm curious. I'm going to have to look into those.
That makes sense. No worries. Well, so that does bring me to Fred's question, which is sort of talking through. I know there are a ton of not a ton. There are companies who are trying to make progress in the psychedelic medicine, and they are trying to have their own novel compounds to kind of control for things like duration, all those different things. Are you kind of in tune with those? How do you see sort of that industry, I guess, going um, in terms of study?
Yeah, yeah. So there's just an explosion of research in biotech and pharmaceutical industries on psychedelics, and yeah, I saw that like there's been, I would say, some pretty convincing work coming out of Cybin, and I'd say what Cybin has done is they're probably going to be one of the biggest proponents for speaking with the FDA about using psilocybin as an approved treatment in the next several years or few years, versus like, right, it was MAP slash Lycos with MDMA. Cybin is probably going to be one of the biggest backers there for psilocybin. And I'd say that the work that I've seen from them, again, it seems pretty rigorous, fairly convincing. There's still work to be done, but these trials are getting larger and larger. And we're seeing it for a variety of different substances, right? There are different organizations in Europe, in the UK, that are investigating one of the psychedelics I talked about earlier, 5-MeO-DMT. We're seeing bigger backers of these quote unquote rapid acting psychedelics because when you think about scalability, that's always going to be an issue with these long lasting ones. With psilocybin, 4 to 6, sometimes a bit more hours. LSD, quite long, 10 to 12 hours. But when we talk about DMT and 5-MeO-DMT, depending on how it's administered again, but intravenously, inhaled, vaporized, 15, 20 minutes, maybe 30 tops. And that can be quite a revelation when we think about how you can scale those sorts of designs and therapies writ large.
Yeah, that makes sense. So in general, do you think that sort of the public companies working in this like Cybin, does that help sort of propel the industry forward? Does it help propel your work at all? Or is it just sort of a parallel that's good feeding into making progress sort of on psychedelics kind of more broadly?
Hmm. Yeah, I think there's obviously pros and cons, right? Whenever we start thinking about research that occurs outside of academic contexts, I
Mhm.
don't think what goes on in the academy is the only way to conduct research, and I think that that can obviously constrain a lot of really potentially helpful therapies. Uh, but you want to always take a critical eye when evaluating research that comes from either public or private companies. This was one of the issues that came up right with the FDA's advisory board with MDMA, whether or not you want to believe certain things that came up or real things that they actually did talk about their issues too. There's always things to consider. But I think at large, given that this psychedelics for a long time has been a bit of a grassroots approach, the more kind of rigorous backings that we can get with psychedelic research from multiple different angles, I say the better, because how else can you better identify whether there are these improvements, there are these benefits, and are there costs, are there risks? The only way you can try and look at that is by getting larger and larger sample pools, bigger studies across different cultures and what have you. And so I think it can be effective when you have people from these things approaching in parallel, whether it's in academic institutions or outside of academia, but you also find that they're kind of working with each other as well. I can think of several studies where different organizations have actually worked with either whether it's for a contract or what have you, but with PIs at universities, they are many of the authors on the papers that actually run the trials. So it's an interesting, I think, a bit of a Wild West context when you think about psychedelics, but when you look at how pharmaceutical research and other sorts of related types of research like that has been conducted over the years, it's no surprise that it's happening.
I would like to take it one step further because I feel like I think that is to me progress in terms of just research and trying to at least get some data and more information there. But I have also seen some cities or small areas do sort of a movement towards recreational and sort
Mm,
of decriminalizing, which I think, not good to criminalize necessarily, but it does increase access to people who maybe who are not approaching it with the same sort of um, care, I guess, ultimately that you are. What's your thought on that? Again, I know that's not a national thing. I know that's, certain cities have kind of allowed for it, including DC.
mm.
I don't know. Do you have any thoughts on the impact of that? Because I think that could go well, fine, but I think it also could be negative if someone misuses it and they don't know what they're getting into. I don't know. Do you have any thoughts there?
Yeah, it's a great question. And I think a really important one because when we think about these drugs, these substances, in particular psychedelics, right, they have a low risk profile in terms
Mhm.
of abuse potential and just other sorts of safety concerns compared to other things that are Schedule One. And so I think like when you think about like how people could be impacted on a legal scale for using those types of things that could now, as we're seeing, have important benefits for them. I think it's hard to kind of have an idea against against decriminalization, but you
Mhm.
also want to think about having certain practices in place to make sure
Mhm.
that people are using them as safe as possible. Um, there's data that suggests that when you use psychedelics in what we would call like an unstructured recreational setting, and I'd say within that, like it could be considered recreational if you take it, say, in a ceremonial context,
Sure.
but that's different than I would say unstructured. You just
Yes.
want to go and you're kind of like tripping out, like at a festival or something like that. It's a little
Sure.
bit different than when you might go to see like someone in a ceremony, what have you.
Makes sense.
Unstructured settings, there can be a bit more risks involved. But it looks like planning ahead of time for your experience, that seems to be related with having less risks, a more positive experience. And so when you compare that and kind of extrapolate out to what we're doing at Hopkins, what we're doing at other places, it's a very structured setting. Um, People are prepping ahead of time for a long period. That's why we tend to have what we see as good experiences.
Mhm.
So I think it's just helpful to keep in mind that when we talk about recreational settings, there could potentially be more risks involved just inherently because you're using them either in unknown environments or maybe you're not planning as you would for other types of settings. But again, just the risk profiles that we consider that when we compare these to the other types of drugs that people might use, they're pretty low.
Yeah, I think so too. I think it's one of those things where, to me, it shows up as a data point towards people having an interest in psychedelics and sort of that re-emergence of interest and attention on it. Again, I do think it can be riskier than in a very controlled setting where you very much know what you're getting into. You're kind of being walked through the whole process. But ultimately, I think a data point towards psychedelics and kind of embracing that in different ways. All right. Well, then I would love to just hear sort of what you think the future has in store for psychedelic. I feel like it keeps moving along, but in terms of what you're working on, what are you looking forward to? What are some things that you're excited about?
Yeah. So I guess several things I alluded to earlier, just a better understanding of these subjective effects, the trip, what's going on, how is it important, how can we better capture it? Some of the work that I'm really interested in pulling in is stuff that I spoke to and looked into in my PhD, which was on different types of emotions that people can feel. And there's a large body of work that suggests there are differences between different emotions, whether you're feeling awe, whether it's joy, whether it's compassion. And feeling those types of emotions are connected with certain behavioral outcomes that can be helpful. You feel compassion, you want to help someone. You feel awe, you feel more connected to people. Uh, that hasn't been really investigated in psychedelics so far. So when we talk about like how can we better encapsulate what's going on, I think it's time to kind of stop lumping in a variety of different effects together and saying this was a mystical experience or this is just all the acute subjective experience and start actually delineating what goes on in there, how those might be related uniquely to outcomes, if they are. So that's one of the things I'm super excited about pursuing.
Mhm.
As I mentioned earlier, the project currently doing right now on comparing DMT and 5-MeO-DMT, just more studies that compare between different psychedelics in a rigorous experimental manner like that. I think that's going to be really fascinating because then you can kind of drill down on, okay, so are these things different? How are they different? How can they impact people? One of the other huge things in the field right now to consider is this effective expectancies. So we talk about this a bit with the blinding issues, whether people know what they're getting, whether they're not.
Sure.
Um, but when you talk about the type of effects that people think about, I'm sure a lot of things come to mind when we talk about psilocybin, when we talk about DMT, other things like that. Like you're going to see these types of patterns, you're going to experience this, you're going to meet these people. To what degree is those sort of stories that are kind of milling about that we hear, um, just knowing that kind of impacting what you report and see, and
Yeah.
then what people report, like how they're beneficial. I think those are the kind of things that we really want to look at, and continuing to just look at these risks and benefits profiles. I want to leave this by saying we don't believe that psychedelics are panacea per se, right? They're not a miracle drug. I don't think anything is, but there's a lot of evidence that suggests they can be helpful in many different settings. So, kind of having this more even-keeled approach of thinking about the risks, benefits profile, and continuing to explore how they can help a variety of different clinical indications and things beyond that.
Very well said. All right. Well, Sean, again, thanks so much for doing the work that you do. Again, very, very important. And thanks for taking the time to kind of talk through it and share with people. I think that makes a big difference in terms of sharing that message, sharing that story is very important. How would people just kind of stay in the loop with what's going on? Any resources that you'd point them towards just to kind of learn more, kind of just get a better sense of the work that's going on?
Yeah, absolutely. So, I'd say our center, the
Mhm.
Center for Psychedelic and Consciousness Research at Johns Hopkins, is one of the key ways you can kind of follow up. We have a newsletter there. Our website also talks about all the different trials that we currently have going on. So if you, your friends, your loved ones think that there may be a way in which psychedelics could potentially be beneficial, you might want to check this out because I'd say that one of the potentially safest, most supportive ways that you can see if this could potentially help is in a clinical trial context. So hopkinspsychedelic.org is that website. There's a lot of different resources there. You can, of course, follow my coworkers, me on Twitter. There's a lot of different organizations along those lines, but those might be a good starting point just to try and dip your toes in, see what's going on with their work.
I think that's great. All right. Well, thanks again so much. Really appreciate it. Thanks everyone for being here too. Really, really appreciate it. And we will see you next time. Enjoy the rest of your Monday. All right. Bye.
Before investing, carefully consider the investment objectives, risks, charges, and expenses found in the prospectus, available at AdvisorShares.com.